Genetic factors can significantly influence the response and adverse effects of psychotropic medications, including antidepressants and antipsychotics. Here are some key genetic considerations. The CYP2D6 gene encodes an enzyme responsible for metabolizing many antidepressants, including selective serotonin reuptake inhibitors and tricyclic antidepressants. Genetic variations in CYP2D6 can lead to differences in drug metabolism and plasma concentrations. Poor metabolizers may experience reduced drug efficacy, while ultra-rapid metabolizers may be at higher risk of adverse effects or require lower dosages. The SLC6A4 gene influences the serotonin transporter, which is the target of selective serotonin reuptake inhibitors. Variations in this gene, such as the serotonin transporter-linked polymorphic region, have been associated with differential treatment response and susceptibility to adverse effects. Genetic variations in the HTR2A gene, which encodes the serotonin 2A receptor, have been linked to antidepressant response. Some studies suggest that certain variations may predict a better response to specific classes of antidepressants, such as selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors. CYP2D6 and CYP2C19 genotypes. Similar to antidepressants, the metabolism of many antipsychotics such as risperidone and haloperidol is influenced by CYP2D6 and CYP2C19 enzymes. Genetic variations in these genes can affect drug metabolism and plasma concentrations, leading to variable treatment response and risk of adverse effects. DRD2 genotype. The dopamine D2 receptor, encoded by the DRD2 gene, is the target of many antipsychotics. Genetic variations in DRD2 have been associated with treatment response and side effect profiles. For example, certain polymorphisms may contribute to increased susceptibility to extrapyramidal symptoms, or EPS, or hyperprolactinemia. HTR2C genotype. The serotonin 2C receptor, encoded by the HTR2C gene, is involved in the mechanism of action of some antipsychotics. Genetic variations in HTR2C have been linked to treatment response and the risk of side effects, including weight gain and metabolic disturbances. It's important to note that while these genetic factors can provide valuable insights, they are just one piece of the puzzle in determining the most appropriate psychotropic medication and dosage for an individual. Clinical factors, patient history, and therapeutic monitoring should also be taken into account when making treatment decisions. Pharmacogenomic testing can assist clinicians in personalized prescribing and optimizing treatment outcomes, but it should be integrated with comprehensive clinical assessments and ongoing monitoring of patients' responses to medication.